Okay. Greetings, everyone. Good morning, good evening. I know that we're joining from multiple locations. First off, I just want to make sure, can anybody see this? Can everybody see this? The slides?
I can see it.
Okay.
Yeah, we can.
Okay, great. So I think I met some of you during the interview process, but for most of you, I didn't get a chance to meet you during the orientation because I was out of the country, and I wanted to apologize for not being there. But I thought that this would be a good opportunity to kind of have this career development webinar and get to know you, as well as kind of share some of my lessons learned through my career path. And what I want to say is that this is like my journey, and currently I serve as the Site PI at UCLA for the GloCal Fellowship Program. So some of the lessons learned may not be directly relevant to your career path, but I think if we think about the broad buckets that I'm going to highlight, I'm hopeful that most of this will be at least relevant and applicable. Okay, so let me sure. All right, so in terms of outline, I want to spend a few minutes. So I think the slide deck that I prepared, it's probably going to go probably less than half an hour. So I want to devote time for us to have an informal Q&A session. So the three broad buckets I wanted to highlight is as you're embarking on your research career, I think building your research career is really important. And intimately tied to that is strategizing, how you build your mentors. And I'll talk a bit about, the types of mentors that I'll be suggesting. And for many of us who are doing, community engaged work, and some of you may not be doing directly partnering with community members or community organizations. But if you are put in a position to advance your research career by partnering with your community partners, I think there's some key ingredients that I wanted to kind of highlight. Okay, so just a little background in terms of my career path. So I'm trained as an epidemiologist. I got my degree here at Fielding School of Public Health at UCLA. But I have a primary appointment in the Department of Psychiatry and Biobehavioral Sciences. So in the David Geffen School of Medicine. So I'm kind of in a unique position where trained as an epidemiologist, but I do a lot of, behavioral interventions. So early in my career, I started doing a lot of designing behavioral interventions for communities impacted by HIV in Southeast Asia. So I've participated in trials in Thailand as well as in Vietnam. And then I think as I embarked on my journey, the HIV prevention and treatment field, my interest expanded to beyond just HIV. So I think especially during the current climate, when you're thinking about folks who are impacted by HIV, you also have to think about some of these other significant social determinants of health that influence the individual from being at risk for HIV or living with HIV. So we're talking about mental health conditions, housing instability. In the U.S., we also have to address systemic racism and discrimination, and also substance use and sexual risk. So I think when we think about HIV prevention and treatment, we not only have to address the HIV issue, but we have to address or support the person as a whole person. And in terms of my current role, I serve as the Director of Research and Evaluation in the Division of Population Behavior Health at School of Medicine. And we do a lot of evaluating programs to look at trauma and resilience informed care for children, families, and adults in LA County. I've also been fortunate enough to be involved in recruitment of vulnerable and minoritized youth living with HIV as well as at risk for HIV. And it's through the NIH-funded Adolescent Medicine Trials Network. Um, and I'll talk a little bit about, building your research career. I was fortunate enough to be involved in this consumer preference method called conjoint analysis to look at acceptability of various biomedical interventions in the US, in Thailand, in Canada, Peru, and Haiti. And last but not least, the training and mentoring is a really significant and important bucket and part of my part of my career. So as you know, I am a UCLA PI for the GloCal Fellowship. I've also been fortunate to be part of other D43 HIV training programs in Thailand, Myanmar, Vietnam, Cambodia, and China. And currently, there's a proposal that has been reviewed that's going to be continuing this 440 HIV training program in Chiang Mai University in Thailand and Hanoi Medical University in Vietnam. And it looks like it's going to get funded. So I'm really looking forward to continuing this training program. In terms of mentoring, I have a joint appointment in the Department of Epidemiology. So I mentor a lot of master's and doctoral students as well as research staff. I've also been a mentor for T32 postdoctoral fellowship funded through NIMH. And in the School of Medicine, we have this mentoring program called Justice, Equity, Diversity, Inclusion Academic Mentoring Program for Black and Brown faculty in the School of Medicine. So I serve as a mentor. So the overarching theme, although I started focusing on just HIV, currently I co-lead one of the research themes in the School of Medicine called Health Equity and Translational Social Science research theme. And I think the work that I've been involved in is very much aligned with advancing health equity. And I think this might be applicable for most of you as you embark on your career, as you're thinking about serving priority populations. It's also important to think about health equity. And as we're making all these advances in public health, it is also very important to make sure that the wonderful interventions that we develop gets translated into the real world community setting. So I think the idea of implementation science is really important. All right. So in terms of building your research career, I think really important advice I want to impart is you want to be proactive, but you also want to be selective. So one example is that as you embark on your research career in the early phase, you may be, getting a lot of opportunities from your colleagues and your mentors. And it's really, really important to seek opportunities for example, opportunities to collaborate on study together, opportunities to write a manuscript with somebody and yourself being a co-author. So I think being proactive is really important and being honest and vulnerable and reaching out to other people to ask for opportunities. At the same time, you also want to be selective. So, obviously you're here because you're all very competent and talented. And you may be, people might reach out to you for various reasons to collaborate on papers, on opportunities. And, it doesn't necessarily mean that you should be taking on all the opportunities that come your way. And I think a good example is, as you build your career and as you build your publications, obviously it's really good to have multiple publications, but it's also equally important to make sure that your publications are kind of coherent and cohesive. So the number of publications is important, but if all the publications are very disjointed and like, you have 10 publications, but they're all about totally different things, it might be less impactful than having like just 7 publications that are all related and building on from one another. So I think an example from my experience is that early in the year, 2005 and 2006, I got involved in, HIV vaccine acceptability study, and we used this innovative method called conjoint analysis to assess acceptability of this hypothetical HIV vaccine among, minoritized communities in US and Thailand and Canada. And I think that skill set, I was I was intentional about building and continuing that skill set. So I was able to apply conjoint analysis on various other biomedical interventions. So, pre-exposure prophylaxis before it was approved. And so PrEP was approved, I think, in 2012, and this was like during the trial. And then, willingness to test for HIV, like a lot of point of care testing, and also, kind of continuing on and looking at acceptability of long-acting injectables. So I think it's important to carve your skill, and it's also important to kind of build on from your expertise. And I think as you embark on your journey, it's important to kind of think about what your expertise is. And as others are thinking about collaborators, and they'll say, oh, so and so has expertise in X, Y, and Z, so we should really invite this person. So being proactive, but also selective. So this is sort of a very specific to my research career. So I'm a professor in residence in the Department of Psychiatry. So for professors in residence, we have 3 broad buckets for us to build in order to continue to become promoted to further steps. So the first and foremost, research competence and research productivity is really important. So what I would say is that as you embark on your research career early on, I would prioritize investing your time on advancing your research first before committing to like service activities or teaching. So teaching is important, but I think it's better, it's more strategic to build your research portfolio first. And as you become more competent and more established, I think you'll have luxury and time to really devote yourself as a mentor and mentoring other emerging investigators. Okay, so I think building your research career, it's obviously very important to have great mentors, right? So all of you have, really, I believe all of you have really strong mentors for your fellowship. So it's really important to identify the mentors. So first off, positive thing is that most mentors are very generous and incredibly giving. And it's important to identify mentors who can really address your training gaps. But also at the same time, there are mentors that are, mentoring you on academic, competence in academic areas and research areas. But there might be other mentors that can support you on other aspects. For example, a mentor that might have similar, heritage with you, or mentors who can kind of give you advice on work-life balance. So I think when we think about mentors, mentors can serve various functions, and some mentors might be just a great mentor just to have like, a check-in session to kind of get advice on general things, not necessarily academic training gaps. And I think as you build your research career, it's really important to also be open to learning and new areas and new topics. And as you identify new areas, it's important to identify mentors that can support you to kind of build your new area. And I think the trick is to have a healthy balance. So this is similar to the publication advice that I gave you. So it's important to kind of be open to learning new ideas, but you also want to make sure that those new ideas that you're learning is in alignment with your ultimate long-term career goal. So, you want to be well-rounded. You want to have expertise. You also want to have, competence in various areas. And you also want to make sure that these areas are all sort of in alignment with each other to inform your future career path. So speaking of mentors, this is like a very busy slide that I wanted to highlight in terms of how fortunate I was along my research career path, including, starting as an undergraduate at Tufts University. I had really, fortune to have various influential and impactful mentors along the way who guided me throughout my research career. So as you can see, I was lucky to have many, many mentors along the way. And some of these mentors I still, keep in touch with and interact with. So I think, having a mentor mentee relationship. I want to say it could be a lifelong, relationship going forward. So there might be mentors that are very helpful and influential early in your career, and you may not be, interacting with that person as often as you did before. But at the same time, there are mentors that can, stay with you for a very long time. So I think identifying mentors that can really support you long term is really key. So I don't know how many of you are planning to apply for. So for colleagues in low and middle income countries, I think the mechanism is called K43. It's a career development award, and for U.S. Colleagues, I think the parallel mechanism is a Career Development Award. I think there's like K01 and K23. So I was fortunate to get awarded Career Development Award K01 through National Institute of Mental Health. And what I wanted to kind of highlight is, getting a Career Development Award, it's a competitive award. But it's also important to kind of tell a compelling story. So, step one is, so the purpose of the award is to, give you protected time so that you can develop a research portfolio to become independent researcher the long term. So I think in terms of carving this story, you first want to demonstrate your competence. So you want to make sure that, the funder, Forward International Center, you want to make sure that they know that, you are worth investing because you are you're like a rising star, you have a lot of competence. But at the same time, you want to also make sure that you articulate, in order to become an independent researcher, these are the areas that I will training gaps. So these are the areas that I would need to further my career as an independent researcher. And then once you identify those gaps, so in my case, I'm trained as an epidemiologist early on in my career, and it was very quantitative based. So my training gap was around qualitative data analysis and also thinking about designing interventions. So in my case, it was designing interventions for, people living with HIV who have not disclosed their HIV status. So intervention design was also a competence gap that I had. And then once you design an intervention, you want to monitor the efficacy of the intervention. So doing like longitudinal data analysis was also an area that I wanted to kind of improve on. So once you identify those areas that you want to get trained in, you want to identify the mentors to support your training gap. So for example, like, I had a mentor who was an expert in qualitative research methods. I had a mentor who was an intervention scientist, and then a biostats, professor who was an expert in doing longitudinal data analysis. And all these, co-mentors are important, but it's also very important to identify a primary mentor that can support you and that can interact with other co-mentors along the way. And then once you identify those training gaps and identify the mentors, you want to propose a research study that can support those training gaps. So my research study involved, doing in-depth interview and qualitative focus groups to fulfill my, the qualitative data analysis training. And then the phase one was doing formative work. And then phase two was intervention design based on the formative work that we did in phase one. And then the third phase was to implement and pilot the intervention and doing a 12-month follow-up assessment. So, in terms of being very intentional about the stories and making sure that your training gaps, your mentors, and your proposed research all align together, I think that's a really I think an important kind of strategy that you can take if you're considering a career development award. And then in terms of your research career, some of you may be embarking on a research career path that may not really be necessary to have, community partners to collaborate with. But many of us, especially in the field of implementation science, it's really important to, establish partnership with your community-based or agencies so that the work that you want to do can get translated in the real world setting. And I think some of the lessons that I learned is that first you have to recognize, so my, position as a, Asian American faculty with privilege at an institution like UCLA, you also want to make sure that you invest enough time to build meaningful relationship with community-based organizations. So it's not automatic to assume that community-based organizations are thinking of UCLA faculty as like, in a positive light. And it's important to recognize some of these real experiences communities face when working with academic faculty. So you want to, invest time to build relationships, meaningful relationship with community members, community agency leaders. And if at all possible, it's also important to involve them early in the research process. So instead of designing a study or intervention on your own, before you conceptualize an intervention, it might be, if the opportunity presents itself, it's important to involve community leaders and community members early on in the process. In terms of providing resources, a good example is like getting funding from NIH to co-design the intervention and implement the study together. Being respectful is really important. I think a lot of times we have different priorities. So academic researchers might have priorities in terms of advancing, designing the program, advancing the research and publications. Community-based organization leaders, their priority might be to, serve their clients to their best ability, and research may not be, on top of their, priority list. So it's really important to be respectful and, kind of understand their position and priority. Fostering two-way communication, what you propose may not be possible in the real world setting, but it's important to have that honest conversation. so that your research can be implemented in the right manner. And last but not least, you have to acknowledge and honor community contributions and recognize them in through many different modalities. It could be like inviting them to conferences, have them present, co-present, or like being giving them opportunity to become a first author on a paper, and other opportunities. So in conclusion, I think in terms of building your research career, you want to be proactive. You want to seek out opportunities, but if it's possible, you also want to be selective. So it's okay to say no if the opportunity is not in perfect alignment with your career goal. And research career, you want to demonstrate your competence and productivity in key areas. And I think competence meaning like it's important to kind of carve out your own expertise. So my case was, consumer preference, conjoint analysis method. So as other colleagues are implementing or designing a new proposal, and if they have like some consumer preference research component, oftentimes they'll reach out to me to be like a consultant or a co-investigator on their proposal. And then as you're building your research career, it's key to identify various mentors to really support you. In terms of community partnership, you want to listen and really listen first and respect where they're coming from, and then you can provide your thoughts. So listen first, speak later. And always, I think it's important to pay it forward. So I would say, the GloCal Fellowship is really such a great opportunity, and it's an opportunity for each of you to think about, being a peer mentor going forward and supporting your colleagues along the way. So as I mentioned, I wasn't able to make the orientation back in July because it was our first post-COVID family vacation in Krabi Island in southern Thailand. So this is a picture that we took, and as a personal, I guess, disclosure, I'm really fond of like, I have a huge collection of denim, raw denim. I like denim jeans and denim jackets. And my wife's cousin used AI to make it look like I'm wearing like a jean jacket in the ocean. So that's not real, but that's just a side comment. But I want to thank you for your attention, and I want to open it up for question Q&A session. Okay. Any thoughts, questions? We have time.
Hey, Dr. Lee. My name is Mark Yost. I'm actually a general surgery resident at UCLA.
Hi, Mark. I know Katrine well, so I'm sorry I didn't get to meet you at the orientation.
Oh, no worries. I come back. I'll come back for residency when it resumes in the summer. So you'll have plenty of me for a couple of years.
Okay.
I just have a question. I guess it's a little more, because I'm not a PhD, I'm an MD.
Mhm.
I really liked the point that you made early about making time to establish yourself research wise
Yeah.
while putting kind of, I don't know, you can always correct me if I missay this, but putting kind of the teaching
Mhm.
and service needs kind of less.
Yeah.
Whereas I constantly see a lot of young attending surgeons become much more involved in like the teaching and the
Right.
service aspect of their career, and they end up losing their research focus in a number of years. So I guess, do you
Right.
have any tips to like stay true to that North Star going forward?
Yeah. I think, Mark, that's such a great question. And I think in terms of my journey, obviously I have a PhD in epidemiology, and but I think in your case, so in the School of Medicine, there's an office of physician scientist career development. So these are, I think it's led by five esteemed colleagues who support physician scientists. So these are clinicians who also want to embark in, advancing their research portfolio. And I think it's really hard because you have your clinical responsibilities and you have teaching responsibilities for your attendings and residents and trainees. So what I would say is that there might be opportunities where, so one good example is, I think a lot of these big center grants have a mechanism called diversity supplement, where the diversity supplement can kind of give you protected time so that you can at least have that protected time to advance your research. So I think that's one concrete mechanism that can allow physician scientists to kind of advance their research career while balancing other responsibilities.
Thank you so much. I'm gonna look up that office.
Sure, sure. And I think it's Mitch Wong, Kendrick Duru, Otto Yang, Patty Gantz, and Linda Deemer. Those are the leaders. And it's I think if you look at the David Geffen School of Medicine leadership page, it should come up.
Okay, thank you.
Sure. Any other questions?
Hi, Dr. Lee.
Hi.
My name's Andrew. I'm a medical student that I'm applying to psychiatry residency this fall, actually.
Oh, great.
But I was wondering what major international connections with uh, other universities that your department has, and particularly about the new one you mentioned with Hanoi Medical University, because that's where I'm based this year.
Oh, okay. So I think Hao is also here, right? So I think Hao Bui, she's also from the Hanoi Medical
Yes,
University.
yeah.
Hi, Hao. So I think in the Department of Psychiatry, so I'm in the Psychiatry Division of Population Behavior Health. And as I mentioned, we have colleagues within our department that have ongoing collaboration with Dr. Zhang from Hanoi Medical University. And beyond that, so we have research programs like our mechanism, like R01, R34, that we collaborate with Hanoi Medical University. In terms of the HIV training program, it's a D43 mechanism HIV, Fogarty HIV training program, and it's a partnership with UCLA, Hanoi Medical University, and Chiang Mai University in northern Thailand. But that training program is focused on providing training to faculty in Thailand and Vietnam to come train at UCLA for a 9-month period, and then they'll go back to Chiang Mai and Hanoi to become leaders in their department. So I think for medical residents, it's not as relevant, but I think the point is we do have concrete partnership with Chiang Mai University as well as Hanoi Medical University. So if there's opportunities that you want to seek, kind of leveraging that partnership, we are able to kind of coordinate that.
Okay, thank you. Very interesting.
Sure. Okay. Judith has a question. Okay, so did you ever set timelines at the start of your research career, and what was key to meeting these, if at all you set any? Question 2, what is the number one thing your mentors did or told you that has been key to your career growth? Okay, so in terms of timeline, I think it's important to set, so I think kind of reflecting on my journey, I want to also highlight that I was really lucky because I think a lot of things happened without me being like intentional about it. So for example, I was trained in epidemiology, but I'm in psychiatry, and the reason that happened was because, as I was starting my doctoral degree in epidemiology, my advisor had a, collaborative project in China with a director at a center in psychiatry that were doing popular opinion leader project in HIV in China. And I was presenting my master's field work at a conference, and my advisor, and then I got my degree MPH at Yale, and that conference that year, the keynote speaker was Mike Merson, who was the dean of the School of Public Health at Yale at the time. Mike Merson was colleagues with my advisor and the director in psychiatry. So after my talk, Mike came by, and then and I've met him like just a few times when I was doing my MPH, and he was like, he spoke really highly. He was like, yeah, Jay was so great at MPH at Yale, and he's such a wonderful, researcher. And then my advisor, Roger, is like, oh yeah, he's one of my students. And then Mary Jane, who was the director at a psychiatry center, said, oh, I have a job for you, so you should come work for my center. So I started working at the Psychiatry Center for Community Health early on as a graduate student. And then after I got my degree, I started work full-time as a researcher at the center. So in terms of timeline, it kind of just fell naturally without me like planning it. Having said that, I think it's important to kind of come up with your timeline goals, but also make sure that, you want to stay flexible because, just because you have a concrete timeline doesn't necessarily mean that it's going to happen. So for example, like K43 mechanism is an important one. Like you might apply and then you may not get it the first time. So your timeline has to be adjusted so that you have to wait until you can revise and resubmit so it might take longer than you think. But it's okay to be flexible and patient. So the question two, what is the number one thing your mentors did or told you that has been key to? So I would say that, reflecting on my career, there were mentors that were really instrumental and helpful, but, I would say there are also mentors that were not as supportive, or, like not in perfect alignment with your research career path. And it's important to, and when I had those difficulties, my primary mentor was the one that kind of gave me advice saying that it is okay to walk away from mentors that are not supportive. So, it's okay to say no, and it's okay to kind of sever ties with, mentors. Doesn't matter how established they are. If they're not, kind of sharing your vision and you feel like you're not advancing, it's okay to kind of sever ties. So I would say advice is, being honest and open about, your mentor-mentee relationship. Okay, so Stephen, would you advise an early career researcher to work on more than one project? More than one project, as long as it's 50% effort on each? That's a good question. I think it all depends on, how you can balance. So I think if those two projects are very, very different, and so it might be a little more challenging, but as long as those projects are sort of related, and I think this goes back to my point about making sure that your projects kind of inform your future long-term career path. So as long as you're really passionate about both projects And as long as you know how to balance your time, I think it's possible. Okay, so Dr. Merlin, community medicine from India. I wanted to ask how we select a mentor. And after selection, how we build rapport and how often should we engage with them? Should we choose mentors only in our field or out of our comfort zones? That's a great question. I think, selecting a mentor, it's about, having that connection with the mentor. So obviously, I think if there are mentors that are like a super like established expert in a specific field, I think it's important to reach out to that person. So I think, mentors that can fill your academic training gap is important. But then if we think about mentors, and this is also the idea that, what you learn from your mentors, you can also learn how to become mentors on your own. So it's not really, there's no like specific manual or instructions on, what's the best mentor-mentee relationship. But I think building a rapport, there might be, many different ways you can do that. My experience was like mentors are really, we're all humans and mentors are really generous. And sometimes if you identify an area that's not even academic, but area that resonates, and like you find the common thread, that can really help you. So it could be about your background, or it could be your interests other than research interests. And a lot of us have families, and so like I have 13-year-old boy-girl twins, and I also support my parents. So we're in a sandwich generation where I'm taking care of my kids as well as taking care of my parents. I have colleagues and mentors and peer mentors that are going through the same challenges. So we support each other by, kind of sharing our struggles and concerns about, how difficult it is to balance, taking care of your elderly as well as taking care of your young ones. So I think, reaching out to different colleagues as peer mentors, reaching out to senior colleagues for mentors. I think you'll know, and it's, sometimes you can make mistakes. Sometimes you think that this person is great, and then turns out that that person is not really supporting your vision or your career. I think it's great to, reach out to mentors that are not in your field. Yeah, so I would encourage you to go out of your comfort zones to reach out to other mentors, and not necessarily even beyond your institution. And mentors, they also like mentees from different discipline because they also learn from them. So I think that would be my advice. Do you think a PhD is a prerequisite for a successful research career? I would say not necessarily. I think it depends on, your institution, your research career. So I think my advice would be kind of reach out to your network and see, identify folks who have been successful in their career in your institution and your network, and kind of seek their advice. So if they were able to be successful without having a PhD, but they might have other degrees, it's equally important to kind of identify mentors and partners and community agencies that can support your work. Talk about finding collaborators, still a myth for me. Can you clarify that? Like, what do you mean? Finding collaborators.
Hi, Jay. Thank you.
Hi.
No, it's like we talk about the thing of collaborating all the time. I mean, from the time I started a GloCal fellowship, it has been one of those, like almost every talk you go to someone, you say about collaborating. So I don't know, how do you define it yourself? What exactly is collaborating?
Hmm. Yeah, I mean, I think in terms of, collaborating, so there's different levels of collaboration, right? So I would say for colleagues embarking on your research career early on, collaborating with other faculty or other researchers, you want to make sure that you're gaining something from that collaboration. So, if you're really competent, you might be put in a position where senior colleague might, to be honest, like almost take advantage of your research skills and competence and give you collaboration opportunities that may not be in alignment with what you want to do. So you might end up like doing like, task. I'm just making it up, like, okay, data cleaning task that's not really in alignment with your research goal, but you might end up like, being handed that, task because, the senior colleague says, oh yeah, I'm collaborating with Judith and she knows how to clean data. But if cleaning data is not what you want to do, then that collaboration is not going to be advancing your career. So I think seeking partners to collaborate with, the best way to do is to seek collaborations where they recognize your expertise and honor your skill set. And you can shine and you can, kind of make contributions to the project based on what you can provide. But, if the collaboration is more to kind of benefit the other person, then it's okay to respectfully decline the opportunity. Um, okay, so I think I have two more here. So how could you please advise an early career researcher that elements should be important to identify, um, and how to be selective on your journey to identify a career path? So I think there's no like a manual for this, right? So I think how in your case it's really important to, and I think you have a really good mentor, and it's important for you to seek guidance, especially early in your career, to seek guidance on how to embark on your research career, to build your research career. And I think in the field of, like in your case, in the field of substance use and HIV, the field is always evolving and there's advances that happen, pretty rapidly. So it is important to, stay close connection with your mentor to be flexible in terms of like adapting your research career going forward. So, what was really a hot topic 2 years ago may not be quite hot topic anymore. So a good example is like this application of artificial intelligence now. So now, AI is like very pervasive but it's not really, I don't think it's going to go away, but it's also an opportunity for us to integrate the use of AI in the work that we do, and your mentor can tell you or advise you on how to kind of insert that component into your research career path.
Thank you, Jay.
Okay, Nafisa, good to see you. What qualities did you look for when picking mentors? Yeah, so for Kay, I would say your primary mentor is like the most important mentor that will support you. and you can work with your primary mentor to identify co-mentors that can kind of fill your or advise on your training gaps. There's one of my colleagues. So the most helpful assets. And then the other thing that was really helpful for my journey for the K application process was I had a colleague who so it's a peer mentor. So he was a peer mentor to me. So he was a year ahead of me. He successfully got his KO1, and he generously shared his lessons learned, and he gave me guidance on, first and foremost, identify your primary mentor, get their commitment, and then, figure out how to build your mentors in consultation with your primary mentor. And this whole idea about connecting your training gaps to mentors, to research ideas, that kind of that concrete narrative, that was the advice I got from my peer mentor that was successful in getting the K. Okay.
That's super helpful. Thank you so much, Jay. Good to see you.
Yeah. Okay. So my talk was half an hour, but we're almost at time. So I know that this has been recorded, and feel free to reach out to me if you have any additional questions. And again, congratulations on this fellowship, and I am hopeful and optimistic that all of you will make significant contributions to the field. So thanks.
Great. Thanks so much, Jay.
Okay, so
Thank you very much.
yeah, we
Great.
have another colleague lined up for February, right?
Yes. And
Okay.
actually next Thursday, we have our next works in progress. So I'll be seeing all of you again next Thursday at the same time. And then, yes, our next career development will be on February 1st, because we're actually doing the first Thursday. It's this one we did later because of the holidays. So we're going to send out the calendar invite for that today, probably. So
Sounds good. All right, thanks everyone.
thank you.
Bye.
Bye.